Well, it's a great pleasure for me to be here, actually, and to connect with old and new friends from my time in service in government. And I think it's good to be back in Washington, but I'm not sure yet. I'll let you know a little bit later this morning. I want to extend a great thanks to Magali and the planners of this conference for inviting me. I want to acknowledge and really thank Steve for his vision and the organizations that he has put together because it really is about partnerships and philanthropy and vision and organizing in order to get these thorny problems solved. It also emphasizes the importance of civil, military, government relationships that coordinate efforts and accelerate their ability to find answers to tough problems. So I'm really pleased to be here today. You know, many people have asked me since I left government a few months ago what some of my takeaway lessons were from my government service. My usual immediate response is, you just can't make this stuff up, you know, when you have had some experiences inside the sausage factory. But there really are three important lessons that I do learn, I did learn or reaffirm. The first was that, you know, our founding fathers actually got it basically right in terms of the three branches of government and the checks and balances. And although we try awfully hard at times to screw this relationship up, in fact, we don't usually damage it too often or too badly. The second is that I reaffirmed the necessity and belief in Jeffersonian democracy. You know, Washington and Jefferson were firm believers that people needed to come from private life into public service and then return to private life, and it was that churn that kept the checks and balances in place but produced a renewal of thought and a focus on what the people needed, and that's important. But these kinds of events really represent that extension of getting the people's concerns and the private sector involved in balancing out government concerns. The third actually is more apropos to this meeting, and that is the world is becoming a more complex environment in which to lead and craft solutions to complex problems that affect the nation and the world. And healthcare and effective healthcare and effective treatment strategies are really at the center of all of that complexity. And you pick up the newspaper and read, you know from your own sort of disciplines and career how difficult solving some of these problems are. But the issue is that the tendency to quickly move to simple, myopically driven solutions and policies really can lead to greater difficulty and create harm and waste resources that are sorely needed in the effort. And so I'm going to spend a few minutes about talking about a parallel process that really needs to go on as all of you are engaged in that very important basic science and basic science discovery. And that really is the development of smart policies that encode the guidelines for doing business in support of the people's needs and is essential to making good progress, advancing progress in many of the areas that you are studying and you are working in. And it's important in establishing better healthcare delivery systems and establishing that holy grail we want for the healthcare delivery system, which is to be safe, effective, efficient, patient-centered, equitable, and learning. And so what the work that Steve has outlined in the network and in the bioscience efforts is really important and contributory to these sorts of efforts. And I like the way Magali challenged us this morning in terms of imagination, integration, and acceleration, but smart policy development is all part of that. So before I elaborate on that a little bit, let me reframe the question in a more positive light, which is, how do we create policies that advance medical research and the efforts to achieve better health and more optimal healthcare delivery, rather than complicated or frustrated or retarded, because that is where the rubber meets the road in trying to bring new products in to integrate it into health systems. If you look at the agenda of this conference, it's really laudable and it's broad. And it's promising for innovation. So there's work being done on biomarkers, including genetic issues, imaging, and standardized assays that may lead to targeted drug development and diagnostic assays. There's work being done on development of biosensors and mobile technologies, translational models, and potential for targeted molecular solutions to the diseases and the problems that are affecting our veterans and our military folks who deploy. New research tools include tissue repositories, methodological standards, data sharing, and analytic platforms, and opportunities to drive care and treatment strategies to a new level. The issue is, however, full achievement of these laudable goals require attention to smart development of policies to bring new drugs to the market, new devices, to integrate them. There's challenging efforts in terms of policy development for funding requirements that will facilitate collaboration and data sharing. I'm from academics before government and now after government, and I can tell you the model that they work on in academia is not about sharing data. It's about my data and what I do in my domain, and I'll tell you about it later when I'm ready to publish, but not before to necessarily collaborate on. And the funding system actually is set up to reinforce that kind of way of doing business. So we need to think about how we redesign research to create open data sources, including repositories and registries that are so important to share and to accelerate improvements. We need to think about how to change HIPAA laws and the common rule to facilitate sharing of information while achieving that data security and the human protections that are so important in research. We need to look at policies which promote connecting the siloed components of how we think about delivering care with advocacy groups, and I'm glad to see Mrs. Winnefield here today. She kept me straight while I was at the Department of Defense, but we need to see how we can bring those together to address the development of sound solutions to complex issues that require technological or biomedical advancement, but also reforms in healthcare systems design. That is, the combination of basic research coupled with translational research, coupled with health services research, and clinical care strategies. And I was very encouraged to hear the comments of my old colleague, Dr. Shulkin, about what's happening at the VA. We need to develop smart policies which should incorporate meaningful metrics to ensure policies are effective and work as they were designed or have the impact desired and not unintended consequences. And we see this very often in terms of policies that are developed. They're developed particularly if they're influenced by one constituency, and it hinders progress in other areas because it misaligns incentives or economic factors, and this is really important. Policies must be crafted to encourage return to health and expand ability of those affected by these health problems rather than promote or encourage disability because they're tied to compensation, earned entitlements, or financial support that they will need in ongoing years. And this is really very important, that we produce an environment in which people want to get well, can take availability of new sort of devices, enroll in studies that may, in fact, be helpful to them to getting well without losing benefits. We need to look at policies which integrate the technological advancements with health system delivery reform and evidence-based care strategies and coordinate these incentives across the domain. In August of 2012, I was proud to be part of the President's initiative by executive order to bring greater focus to mental health issues that affect military personnel and veterans. And out of that came the National Research Action Plan, which you're going to hear more about today. But it was about setting those priorities as a real coordinated agenda for research. At the same time, it was looking at new systems designed to create greater access to care, and also to look at the effectiveness of those systems in terms of delivery of care and measurable outcomes in terms of the effectiveness of the treatment strategies. Now, I want to make clear that I'm not suggesting that all of you, as great scientists, need to become policy wonks. That's not what I'm saying here today. But I do believe that the research enterprises that you have set up, that you are involved with, need to partner with organizations and activities that influence policymakers and develop policies. Otherwise, technical progress will be slowed, and we've seen this already. If you know the story of CRISPR-Cas9 and stem cells, the advancements in science got out ahead of the policies, and that's now stalled further progress. In fact, some have called for moratorium in terms of the genetic editing that can take place until we understand how to employ it effectively. Now, great. I have those slides up, and I'm going to quickly go through just 2 slides. Let's see if I can advance that. So this is what we're all about, and I've used this slide any number of times in any number of talks and speeches because we need to know what centers us. This is the iconic soldier, sailor, airman, or Marine who has borne the responsibility of the defense of this nation for more than 15 years at war. And if you look at this figure, he's burdened, he's heavy laden, and he looks stressed. But we also know that this individual is resilient. But it also focuses us on the need to lighten that load, to create innovative solutions, not only for the equipment that he may carry, but for the psychological burdens that he is going to experience and the experience and his family will experience as a result of that service. Now, if you look at this simple cartoon or graphic, I used to use this when I was in government to explain the variables that go into policy making when I was in government. And understanding the perspective or ring, if you will, which was most prominent in shaping an emerging policy, really gives one an opportunity to rebalance the issues and create better policy. If you look at the inner ring, or inner circle, this represents science, which we, in this audience, of course, are all about. It's that which is replicable, certainly in the lab, and firmly establishes a kind of cause and effect, intervention and outcome. This is what we aspire to, evidence-based care, effective treatments that can be proven. There's one caveat, however. The problem is that we as scientists, we speak, and clinicians, we speak, clinicians speak, and scientists speak. And we sometimes overstate the durability of this relationship once we come out of the lab or the randomized controlled trial into the real world where science meets human systems. We've got to understand better these limitations and help establish policies that allow us for post-implementation evaluation of products and devices, the earliest possible discovery of unintended adverse effects and product modification if we're not going to lose trust with the public and with policy leaders and national leaders. We've got to often communicate, we often communicate what we think is proven, but really represents the art of practice. That's where, in fact, we presume or predict a positive result based upon the application of science in human systems. But the issue really is that we need to develop systems to iterate on our evidence as we apply it. Otherwise, we might get unintended consequences. When we acknowledge these potential shortcomings up front, we set the stage for iterative improvement and limitation of harm, and better define where improvements need to be made, whether or not it's the underlying science, the device, or the system. The outer rings really represent the real world that are important to smart policy development, or at least understanding smart policy development. It is about the economics. How do we create and utilize devices, develop research, develop new treatments that are really sustainable, and not necessarily whether or not it's sustainable because it's particularly takes on the interest of one constituency or another. And we face many of these issues in policy development. The others are self-explanatory. Politics and policies, enough said, basically. Look at, again, what has happened with stem cells. And then it's important to understand this big outer ring called emotion, often confused with facts and more frequently than you think in terms of policy development. We've got to understand where people are coming from and try and bring them back to this inner ring of science and evidence-based strategy for establishing policy. Understanding these factors makes us an ally in smart policy development rather than contributors to ineffective or unsustainable policies. So as I conclude here, the work you are doing is enormously important. There is no doubt about it. You will change a lot of the way we think about disease and disease process. And as I learn more about your work, I have two children who are in neurology and in neuroscience work. I'm convinced that in another several years, what is written in the DSM-5 will have to change dramatically, because when we talk about really functional areas of the brain that might be disturbed, it'll change the phenotypic expression of what is written in books like the DSM-5. You're going to radically change the world, and we've got to be prepared to develop smart policy when those seismic changes come. So making progress in science and medical research, as well as improving strategy for creating healthy populations and care of those veterans who are ill, requires well-designed, smart public policy through a parallel process, but that is linked clearly to the work that you're doing and helps balance all of the variables. So thank you so much for the invitation to be here today. I look forward to a successful conference, and I look forward to learning quite a bit from all of you. Thank you.